Stanford University.
My name is Dr. Tia Rich, and it is a great joy to organize and direct the Contemplation by Design program here at Stanford University. I had the pleasure of meeting Mempa Kalzang, Yangdran Kalzang, when she led a Tibetan Medicine conference here at Stanford earlier this year. It is an annual event that I encourage each of you to keep your eyes open for. It's held in the School of Medicine, and it's deeply inspiring and educational. So after that experience, I was delighted when she accepted the invitation to lead this program in the 2017 Contemplation by Design Summit. As our expression of gratitude, we give you a little mug for warm herbal tea.
Okay. Thank you so much.
And thank you for this session.
Thank you. Beautiful cup. Got all the colors. So I'm going to pass along with the 4 herbal poultices, okay? So can you get it this?
They all go together?
No, you can give a few other people. Yes, they can go around. So I want to smell this first.
They're all the same or different?
They're same. Yes, inside is same. Looks different, probably. Some of them a little bigger, some of them a little smaller. Did all of you get a chance to smell? What did you smell? Say again? Okay. Any others? Cloves? Curry? Okay, good. Let's see. Smells like a little curry, right? Cloves? Cloves? There's a cumin family. There's a caraway seeds. Anybody smell caraway? And any of you make an apple pie? What goes in with the beside the cinnamon, nutmeg, right? Yeah, that one has a nutmeg and caraway seeds. Do you use those spices at home? So I brought the mini kitchen here. You try to stay away from your kitchen, right? You got to here with the little mini kitchen. So I'm going to start with the presentation first. And it is my great delight to be here with the summit this year. And I have seen this summit going on a few years. Never know who organized, and I'm so lucky to meet Tia, Dr. Tia Rich. So thank you very much for inviting me back here. And it is my great pleasure to be here because I really love to share this part of the self-healing method because it can help you a lot without needing of the medications and reduce stress and helping relaxation, helping calming. How many of your students here? Okay. How many people are medical fields? Okay. And what are other people doing? High-tech people here? Yeah. So we have a lot of computers, right? Okay, so nevertheless, what kind of job you're doing, your teacher, student, medical doctors, or computer engineers, any other things, we all have one common thing is the stress nowadays, right? We have plenty of work to do. We can never finish our work. So one thing that made me think is something be really helpful what we can use at home. Once you get home after this 8 hours, 10 hours of work, without you need to look for the medications or I have pain, I have stress, I cannot calm down, I cannot sleep. A lot of people say, I cannot sleep, I cannot fall asleep, not because they don't have enough time to sleep. Some of them have enough time to sleep, but they cannot fall asleep. Or they wake up easily, constantly waking up. So those are the things students go through, right? Doctors go through, patients go through. We all go through this phenomena. So one thing that in Tibet, when I grew up, my grandma used to use this a lot. She used different version, a little bit simpler than this, but what she used to do is she used to heat up some, actually it's a wine. It's heated up with the butter and add in molasses. Then she put some of the herbs and roasted barley in. Then she used to use this to massage herself. So when I was in teenager, I saw her doing this over and over again, and I was always wondering. She always says, I slept really well, and I tell you this dream, that dream, I slept really well. And she always amazed me, and I didn't know what she was doing. But when I was in medical school, one day my aunt had a really serious health problem because of her family, her son, something happened to her son. So she couldn't barely get up from her bed for 3 days. And she couldn't eat, couldn't sleep, and she was just crying in the bed. So we know what it's really called here, right? Depression, right? So I received the call from my aunt, and I was in 3rd or 4th year of medical school. And right that time, I was studying my herbal identified herbs. So I had 2 samples of nutmeg in my herbal studying guide, study 2. So the day before everything happened so coincidentally, but the day before I went to see her in my school, my teacher said about the nutmeg, how to use the nutmeg. You powder them, you do this or you do that. Then can help stress and sleep or those things. But that night I received the phone call from my aunt, so I had to go to see her. So I rode a bicycle for halfway. I didn't know what I was going to do for her. All of a sudden I realized, maybe I can use that nutmeg. Then I went back to get the nutmeg. I only had 2 pieces, so I took 1. So I got to her place maybe after half hour by bike. Then I crushed this nutmeg and I heated up as an oil that you're gonna see today. And I just saw my grandma, what I saw from her, and I heated up, and by listening or remember everything what the teacher was said. So I heated up this in class, in her house, and I did the treatment. And that night, she slept well. She woke up before I did. She said, I slept really well. She could starting to move. So I did 2 more treatments on the same day. She was totally fine. I was so happy because I was a student. I never done anything like that. And that method works. But when I came to US, so what happened is as a Tibetan medicine practitioner, we don't have many other places to practice. And also when they come to see me, they had to wait for me to get the herbs ready because it takes about 20 minutes for me to get ready. And for acupuncture patients, they can lie down on the bed, right? They can rest, but I couldn't do anything. All of a sudden, I was thinking, maybe I can find some way, do something. Then I remembered this method, my aunt's story. So I started with this, and I started doing this treatment. The more I do in clinic, the more benefit I get. But the problem is, a lot of them come from, at that time I was in Santa Cruz. So they're traveling from San Francisco, they're traveling from East Bay, North Bay, and they could only come to see me once a month. So I was thinking, what can I do to help them? They cannot come down to see me every time 2 hours. So I started to testing this on myself, do this treatment, and then for some friends of mine, I started to teach them how to use the self. I simplified the medical version, how to use it at home. So it's been really useful and beneficial. So I started to share this knowledge to a lot of students. Even early this year, we did a big course at the San Francisco Library as well to benefit people. So the main reason what I did this one is really number one function is to reduce anxiety, help stress, and improve sleep. So those are really the main thing that it helps. It comes with lots of other things, but I will mention one by one. But this is the things. So Tibetan medicine itself has been practiced more than 4,000 years in Tibet. You don't have to be Tibetan to be benefit from it. It's a universal medicine, just like Western medicine. We're using the different approach, but no matter who you use for the person, we're just using, it will be beneficial equally. So the method of this treatment, so you use, you use like this. There's a way I will explain everything. Okay, we have many different things here. So this one we call in Tibetan called the Hor-mey. You see this, the word almost like the art that you can recognize. That's a Tibetan language. It's called the Hor-mey. And me means fire or the warm. So together it forms this, the words forms this treatment therapy. So it's called Hor-mey therapy. And originally it's used more for the northern part of Tibet. North is always colder than southern part, right, wherever you go. So we use this a lot. And in terms of, we're going to go through the ingredients and how to prepare those and what are the detailed instructions how to prepare and also what to do after you do the treatment. Then I'm open to questions later, okay? So before we go deep, I want to bring the source of Tibetan medicine to everybody's center here. Excuse me 1 second. So this one is called Medicine Buddha. This one we call Land of the Medicine. So center here is a Medicine Buddha. So surrounding there are a lot of plants, flowers, animals. They all surrounded the Medicine Buddha. So you probably see Mandala, right? You probably see in Tibet or Tibetan Buddhism we use a mandala. But this one is the one we call Medicine Buddha Mandala. And surrounding this, each side of the mandala, the Medicine Buddha, it grows different parts of the animal, of flowers or plants, and they have different properties. So the one in the north will be much cooler function to treat heat conditions. The one in the southern part of the Medicine Buddha will be heating or the warming properties to treat or to heal the cold conditions. So in Tibetan medicine, we do not use the word of what we call bacteria, viruses, fungus, all those things. We use different terminologies. But once you study Western medicine, Tibetan medicine, Chinese medicine, we use different terminologies, but we're actually dealing with the very similar things. So this is one thing that I want to take a moment to ice spa. So how many of you are parents, little kids' parents? So we like to use the ice spa book, right? We see all different things when you ice spa. So you can use the method of ice spa method to see to enjoy some part of the Mandala, because this is a very enriched knowledge of Tibetan medicine, and it's not only oral tradition, it is a tradition of Tibetan medicine since 8th centuries. So we've been using this medicine. And also the Tibetan medicine is also very old version of integrative and holistic medicines. So we don't only rely on medication or one thing to treat your condition. Everything is holistic. Your diet, your sleep, your emotion, your mood, your relationship, everything is a part of your health and healing. So that's the beauty of Tibetan medicine, because right now we see in the West, right? We know acknowledge the integrative and holistic medicine, but it's only for the movement for last 20 or 30 years. So I like to use this as part of like a kind of leadership role of Tibetan medicine to work together with the other form of medicine. And as we had the conference in the past, so it's everything we're putting together with the integrative medicine. So did you get enough time? So we're gonna move on, okay? So speaking of that, we use different plants, and about 80–90% of there are plants based on Tibetan herbal remedies. And one thing what we do is we use this poultice. There are 2 ingredients. You can modify that according to your condition, but base foundation is based on nutmeg and the caraway seeds. And how many of you seen nutmeg in shell? Have you seen the nutmeg in the past? Yeah? Okay. So I brought some of them. They're just dry, but they are actually came off the shell. I even kept all those together. So when they are fresh, they have a shells to see the nut, right? This is still in a shell. So at this stage, you can still smell, but once you pound that, you can smell more. So one of the functions of the nutmeg is very good for cardiovascular, but if you overdose, it's not good. It can increase the agitation. So you use a small amount, especially when you are intaking in. So if you use it externally, we will tell you the proportion you can do equally a little bit higher dose, but not taking in smaller dosage, okay? So Hor-mey helps to relax the mind and body, and also reduce the physical and mental stress, boost the immune system. So by, one of the things why we have a weak immune system is not only lack of nutrition, right? It's also not enough sleep, right? So when you don't get enough sleep, then of course your emotion is always there, up and down. You will become really agitated next day when you are not sleep. Then when you are not sleeping, then it causes many other problems. So sleep is one of the root problems we need to deal with. And it improves concentration, good for all ages. So I will tell you how we can use this, what particular problem we can use. Number 1, anxiety, panic attack, or irritation, agitation, all those very good. And remember my aunt's story? So definitely it's a part of depression. If she was seen by a psychiatrist, it would be depression. She wasn't eating. She didn't have any mode of doing anything. But we didn't use any antidepressant for that. We just used this external therapy. Then next day I made a warm soup. So that helped. Another thing is a migraine. So I do ended up a lot of patients with the migraine headache. They're on Tylenols. They're on much heavier dose of different medicines. Some of them When they become really severe, then of course you need some additional help while we're doing this. But at the early stage, you can always take care of by migraine, especially menstrual-related migraine. It's excellent. You can just do a couple treatment yourself. It goes away. And another thing is the insomnia we just mentioned, and PTSD, ADHD, all those conditions, especially PTSD. Now, I work with a lot of veteran patients, and the number one reason they come is the pain. Number two reason they come is the PTSD. So they are emotionally and physically in pain, in different types of pain. I don't give them many herbal remedies to take in because some of them knew nothing about Tibetan medicine. And I'm sure most of you don't know about Tibetan medicine, right? How many of you know first, by the way? Yeah? How many? Can you raise your hand? Yes. Yeah, that's very true because we don't have many Tibetan doctors working in the West, and even if we have, the language becomes barriers and very hard for public speak type of thing. So it really limits, and we don't have much resource people to sharing the information. But nevertheless, they know acupuncture. They know acupuncture, so the VA patient come to me for acupuncture. So I integrate this method with acupuncture for them, and it has had a great result for them. So some of them say, oh, I've been collecting a lot of my medications. I'm trying to think about the name. I will tell you later. The medications over the counter, I haven't been taking 3 months, 4 months, and they've been collecting all the pills there. And some of them tell me, oh, I was going to see my VA doctor or my therapist 3 times a week. Now I only go once a week. So you see the result really well if you really keep track of it, and you can do that yourself. Another thing is ADHD for adult, for children. We can use this method because ADHD, all those conditions is related with the, we call AIR, AIR, related problems. So it's kind of abstract concept you cannot see, but it's a very cardiovascular related, it's a life force related conditions into your body. So it works really well. Women's health, menstrual related, before menstruation means PMS type of thing, or at early stage before we actually start the menstruation, like in teenager age, during the menstruation, after menstruation, when you have those big cramp, this method works really well. When you have a PMS, works really well. And labor. During the labor, prenatal care, postnatal care, all works. And also for the menopause. So it really works for women's condition, for almost everything, anything we can use this method. And I use a lot for the cancer care and support treatment method because a lot of people come with a stage 3 or stage 4, and some of them even have, they quit the treatment. So what we do, I use as a cancer care, it really helps them calming, help their sleep. And pain management is one thing. And seniors, you can use this for seniors because a lot of time, when we become older, our constitution changes. It becomes more dry, right? It becomes dry throat, dry mouth, dry skin, and itching ears, dry hair. All those are part of the dryness. What's happening is not enough earth and water quality of the elements in the body, but excess of air in the body. So that's what it is. Again, in Tibetan medicine, we base on the 5 elements theories. So we do not go as a what is the viral load, what is the white blood cell, what is the red blood cell, but we go along the 5 elements theory. And another thing is the 5 elements theory, because of that, it cannot be really tested in a blood test. A lot of time, I ended a lot of patients, they come to see me because they got checked with a blood test, MRI, X-ray, everything's normal, which is good, right? On the other hand, they are suffering. what are they suffering? They cannot sleep, they have anxiety, they feel they're uplifted, they cannot calm down, they feel like even if your feet is on the ground, they feel like their feet is up in the air. They do not have the grounding feeling. And some people are actually worse. They do feel pain in the body. And pain, you hear this word, head, shoulder, everywhere. Pain moves around on the head, on the shoulder, on the back. All those things, the people come here. So you can use this method not only for the condition, but also for wellness care, okay? Wellness care means that keep you balanced, so you don't now have to be going to that extreme. So this is the herbs you probably seen. Now I want to show you how it looks inside the bag, okay? So you see that's how we made. So do you want to pass this? Yes, thank you. So you can smell, you can stir this and see how you feel. And I prefer you, later on, I prefer you to touch. Before I forgot, actually, I will have this. If you like to make a couple, you feel free. You can make one, take it with you, okay? Another thing, if you decide to make it, what you need is a really costless. It's cost effective, right? You don't need to spend much money. You don't have to have any insurance to do this. What you need is a piece of fabric and cheesecloth or muslin and scissors and a little thing, thread. So then the herbs. So two options about the herbs. You can either buy the grounded herbs, then you mix them together, then you put in here. Or another option is that you buy the whole herb, so it's not being smashed, so you can use your mortar pestle just to pound, just to ground them. And I prefer you to make this because just by working with the herbs, by smell the herb frequent of the herbs, it will help the calming, because the purpose is to produce the calming, right? To increase the calming function. So this one is one method you can do. I will tell you the measurement once you decide to make it. And in terms of equipment, other things what you need is there are three options. Those are the butter warmer, right? So I guess you put in your food, you prepare the warm butter. So you can use those. Just need a small candle. Inside you put the oil. So what we need is we need a sesame oil. You can either use organic or non-organic sesame oil. It will be going externally. And then another option is the hot plate, like this. This one is they call also the cup warmer, right? You have a cup of coffee, then you heat it, just keep it here being warm. I set up two stationary. Later on, we can practice together here, okay? Another thing, if you don't want to spend the money here, if you make coffee, the old coffee machine, it has the hot plate underneath, so you can just make in your kitchen, then massage in your kitchen, then go to bed, okay? So if you don't have other people coming, so you can use this method. So this part we went through most of them. We just need to go through the dosages or how much we really put it in portion, right? Proportion. So if you mix them together, then you can put about 2 teaspoons. So if you already mixed them, so you can put about 1-2 teaspoons. So it makes up the samples that I have, like this big. But if you have them separate, this one does not have to be fine powdered. So you can have a coarsely powdered, then you can put about 1 teaspoon, and the caraway seeds, 1 teaspoon. So altogether make up 2 teaspoons. Then what you do is once you make this, you just pull all the strain up. Then you can tie with one of those strain. Any strain is fine. So, but in Tibetan medicine, we do work with the color therapy. So like, especially for the anxiety, all those conditions that we're connected is air access means need a lot of calming color. So in Tibetan medicine, normally it's associated with the either yellow color or blue color, dark blue color. So you can use those. And then you tie the knots well. Then it's just like this. If you have children, it's a great project, you know. It only takes you 15, 20 minutes once you have everything together. So now we need to know how often do you do. If you are doing for the wellness, you don't have any condition like I don't have pain or any headache, then you can use twice a month, once every 2 weeks. That's one option using as a wellness care. But if you happen to have some headache or some chronic pain, then you can either do 3 days in a row, then have a break for a while, then you restart. So really no specific set time, but I want you to do, if you're doing wellness, like once a month, if you're not dealing with any pain. But when you have a pain, really, you do a little bit more frequent. And I do have people with a chronic headache. You can do every other day. Really doesn't matter what time of the day. The best, if you can really control the time, the best time is either early in the morning or later in the evening before bedtime. But if you're working class, you're busy at night, you cannot do it, then you find a time. That's the requirement, you know, just find a time. Only need about 10 minutes once you have everything set, so you really don't need that much time. You just need that 10 minutes, you can do it. So in terms of the points, where to choose, how to choose, right? So it's a very simple. My grandma did it, right? So you can do it. We all can do it. And the head, we need to use a few points, 3 points on the head, 3 to 5. That really goes easy. Then some points on the chest area. Then 3, 4 points at the spine area. Then the easiest 4 points are 2 points on the palm, 2 points on the sole. And once you find those, it's very easy. It's very easy to do. So right now what we're going to do is we're going to spend a few minutes to pinpoint those points. And once we go through all, I like you to pair up with the group, 2 people. Then you find the points for each other, especially on the back. You cannot feel yourself too well. Then once you know this, once we finish that in maybe 10 minutes, then we can start to do some demo, okay? So the 4 easiest points are the palms and soles. So we already know 4, right? Instantly. And another points on the head. So we can do either 5 or 7 points, but there a couple of points are paired, so it's not that hard. So what you need is you need to use your hand to measure the points. So how you measure is you use the first line of the pinky finger. Place that on the tip of your nose. 1, 2, 3. So when you do 3, you pinpoint 1 right behind your index finger. Then you go 1 more time. You pinpoint another point. Then you go 2 more times. So it will be like 4 fingers, right? This is a 4-finger breadth. 4, 8, 12, 16, 20, and 24. Not the 20, but 24. So 12, 16, and 24. So those are the 3 points. It's not that hard, right? Then 2 points right here on the temporal. And another 2 points is right behind your ear, not right behind this, but it's more on the side of the occipital, right below the occipital region, on the side. So you know that 2 points. I can pinpoint for you later. So those are the head points. So those points actually it's really good for migraine. And I have people sometimes they come with the urgent care for their head. They have a migraine for no reason, but most of the time they think it's no reason, but a lot of time it's being exposed to the cold or wind or the cold breeze. And some people wash the hair, then go in a cold air or the damp area, so it have that moisture build up, so it can cause pain. So the difference between Eastern and Western medicine, right? The Tibetan medicine, we always talk about is it due to heat or due to cold. In the West, we always say bacteria or viruses, right? So we always different terminologies, but we always identify if it is due to heat or due to cold, what is caused this, because that will change the treatment method. But this one, most of really, especially people along this area, will become calling or caused by the cold or dampness sensation, dampness exterior. We call kind of like evils. So they're kind of like a influence into your head or your body. So those are the things that we need to know. So the head points, we all got it, right? The spine area. So the first point is on the C7. C7 means cervical vertebrae 7. So what you can do is the easiest way is to bend your head down, then use your finger to press like this way down, follow down, then the most protuberance point. So that's the C7. Then you count down, 1, 2, 3, 4, 5. T5, thoracic vertebrae 5, and 6. The 5 is good. You're looking. You found it? That point is a related life force. A lot of things connected with our mental health. And the point right below is a heart, cardiovascular related points. So this point together, very good for the cardiovascular congestions or tightness or shortness of breath, all those things. And another 2 points, if you want to add, if you have either the kidney condition or low back pain or low back pain, but also kidney condition, you probably cannot tell yourself if you have any kidney problem unless there's a lab result, right? Do you know anything, your weakness of kidney without having lab result? Does anybody know? Yes?
If you have bags under your eyes, they're dark under there.
That's good. That's a 1. Any other signs, symptoms? Frequent urination, irritation. Some of those UTI-related problems or some of frequent urination, normally, unless you drink a lot, it's a different story. But in general, if you get abnormal frequent urination, there's always connection with the kidney cold condition. So those may not be able to find out through the blood test. And I do have quite a bit of patients, they actually have a kidney condition without having any signs, symptoms in their blood test or other medical exams. So those are the things you can watch early stage of the signs, because those are in medically they call subclinical signs and symptoms, and we cannot always be able to catch by those exams. when they catch, then something grow or something came up already in the medical. So that part is not seen in the test in our lab. So those are the things you can always try. Another thing is that, so the point about the kidney, so what you need to do is you find the number one. So how you find is you will get lost when you're counting down like this. One way you can do is that you close your eyes, you point it down, count it down, then you can do better job. If that's hard, what you can do is that you find the nearest part of your waist, then you go to the center. That's a L2. Then you go one notch up. Then that will be L1. So really, between the L1, L2, I would recommend both because in Chinese medicine, L2 is a kidney. And in Tibetan medicine, we use L1 as kidney. But kidney is right here, right, in the lower back area. So you can use both or you can choose one, L1. So these 2 points are not bad, right? Easy to reach. So you can use that. Then chest point. Chest point right here, chakra notch here. This is not in a really thick area, really deep area, because you have your trachea, then it will choke you. So right on top of the bone, you feel that little indentation, that one. Then you go middle of the sternum. So kind of level ups with the breast. And then 2 other points on the clavicle bone area. So you go down 1 inch down. So right here, you know you can do this movement, right? Where you feel that little big indentation. This is one good point. This is almost like a top of the lung, right? That's why it really works with the shortness of breath. So you can use all those points not only for the treatment method, but also you can use as a diagnostic method. So when people are going through the anxiety or overwhelming situation, most people, they don't say overwhelmed. What they say, do you know? What they call? Either stressed or they say I'm depressed. So we don't have anything between, no sadness or nothing, it's all gone. So now, once we feel a little down, it's all depressed. Then the next thing is medication. So there are many things we can catch in between. We can take care of ourselves without medication. We do need a medication when it becomes extreme, but definitely at the early stage, there's many other holistic and integrative ways to take care of yourself. So this is one point. Then palms and soles. So now we're going to pause here before we talk about the after. Let me see the time. Okay, so what we want to do is that we pair with a group, 2 people. Then you can help each other to find the head points and spine point. And palm and soles you can find yourself really well, right? Okay, so let's spend a couple minutes for that. So the measurement is, if you want to just do the number of finger breath, is going to be 12, 16, and 24. 12, 16, and 24. When you are stressed, these 2 head points are really painful. All the energy or everything is kept there, so it can be really painful. Yes, yes. So you make sure it goes from here to the tip of your nose, because if you did from here, it will be wider. So from here. Good? You like it? Fine. C7, you bend your neck down. Yeah, you found yourself? Good. Good. Wonderful. So
About peace and sex.
oh, T5 or T6. Yes. Yes, T5 or 6. You found it? No. Okay. So this is a little tricky, right? You have to have a flexible shoulder. So once you have the, that means you've done the job. So you found T7, right? So you kind of,
Is a big one.
yes.
Yeah.
Then you, from here, you count it down. From here, you kind of land. Can you help me to heat it up, the oil there? Over there.
Count each
Yeah, count it down.
After 7,
Yes.
you should count
Yeah.
down to 3,
Yes.
4,
Then
5.
you start 1, 2, 3, 4. Then you probably use your both hands.
I see.
Yeah. So anybody did the job that you will find the hardest thing is find T5 or T6, right? Because it's right there. What you can do is option 1 is if you're by yourself, you just go up from here, or you can use. It's a practice of yoga too, right? So how much you can down. C7, then you count it down. 1, 2, T2, 3. You pop. It will be right between your scapula, right between your scapula. But if you can't find it by yourself, then you just skip that 2 points because these 2 are the points you cannot reach it if you have a shoulder problem or things. But other points were working well because you can focus on the chest area really well. Okay. But if you have you're doing this for family members, then you can find it yourself well. Okay. Yes, C7. Yes. See, this is a T1, then T2, T3, T4, and T5.
So right at the bottom of
Yes.
the scapula.
Yes, T5, T6, right there. Yeah. Yeah, you're welcome. So when you done this, what you can do is we're gonna actually practice this. I want to show you what to do. Okay, so you can either pour the oil into one of those containers that you have, or you can use this. Normally, you can have a little bigger metal one with the heat up faster, but glass one does take a little bit longer to heat it up. I just poured the oil, nothing in there. Then you put one herbs inside, herbal bowl, medicinal poultice, the Hor-mey itself. You put there, you let it heat. Then I will tell you a few things. Oil is a sesame oil, but you can use a ghee. And also, if you make your own ghee, then you can use the bottom part, the substance. You probably seen if you make your own, because that one actually even has a much stronger function to help calming and relaxing and reduce anxiety. If you have aged butter or oil, you can use it. It works even better than the fresh one for this purpose. That's one. And another person asked me a question before, how often do you make it? And do I make it each time when I use? For your purpose, you don't need to. You can use one for 2 or 3 times, at least 3 times for sure. So what you need is you need to refill the oil or the ghee, whatever you're using, oil base. But this part you can reuse. And another is how often do you use is if you're using for wellness, like right before you're having tests but you're not sick, but I'm a little anxious, then you can use this. Like 1 week, you can do like a twice, 2 times before your event, whatever the thing making you nervous. Other times when you have a pain, then you use if you're working on particular condition, then use maybe every other day or twice a week. But if you're working class, you will definitely find less time, so you can use it once a week. It will, even if you use it once a week, it will be helpful. And recently, I've been working with one MD. He travels all the way from San Jose to Daly City. And he has been treated. He had an injury, then strong whiplash. So he actually been treated with acupuncture really well for the pain, but he's really disoriented. And he said he wants to go back to work, but I'm not sure, as being a doctor, if I can be focused at work. So he came to see me 3 times. We only did this treatment, of course, some other herbs, but each time we only did this one with the cupping. Now he's going back to work next Monday. He's so centered, much calmer. He sees really clear. He can really function mentally. And he feel well rested. Before, he had the time because he's taking time off. He can sleep. He has enough time to sleep. He was sleeping almost 12 hours. But next day, he was really exhausted. And that's why his brain was foggy as well. Now he needed less time, but effective sleep. Good quality sleep. So he only sleeps between 7.5 to 8 hours, and he functions well without getting tired. So in addition to the treatment I did in my clinic, he was doing once a week. He started twice a week, then he did it once a week. So it does help a lot. And lately we have this big opioid things, right? So a lot of medications, whatever is causing epidemic, it does really cause this, the tolerance. So you need more and more. So before you even try those methods, there's many other alternative way or integrative way you can think. Sometimes for those conditions, you try it because it doesn't cost you much money to try this method. You can help yourself, your family, you all will be happier and healthier, right? So I hope with this method of my grandma's method, started from there, then I practiced on my aunt, then I really flourishing in the States. I've been working so well in Bay Area, a lot of people getting the benefit from this. So I'm happy to share this. So now last part, I want you really feel it. How about that? So who wants to be the volunteer to do the demo? Okay, so we do both, okay? So how about you come first? We do both. And I want everyone to experience the feeling, the touching and the feeling of the oil. Have a seat. Yes. Where would you like to try, on the neck or on the head or on the palm?
Maybe on the head.
Okay, sure. Have a seat. Okay.
On the neck. I don't know.
Yeah. On the neck?
Maybe.
Okay. Oh, you can turn that way. So your head. Yeah. Yes. Good. Thank you. So can you help me to measure?
Uh-huh.
Okay, I think didn't come that close. Do one more time from tip of your nose. Okay, 1, 2, 3. Yes. Now is it? Okay. 1, 2. Do you feel? How about if you go one more? Right there. Okay. You can let it go now. So you can let it go. Yes. So if you happen to help your children or family, have their hands to measure. Okay. Do you feel the sore? Little bit. Okay. So what you do is right now is a pretty warm temperature, warmer but not that hot. Before you really take it out and put it on, what you want to do is squeeze. Okay. So 1 second. Let me see. So what you need is you squeeze the oil in like this. You see the drops going down, right? The drops falling. Right now it's I would say medium warm. Are you okay? So since you never had it, so I'm just gonna do really gentle, like this. But it's not too hot, right? Okay, we can do like this much. Then you put it back. You reheat. Then you squeeze again. Right now I put it in a slow motion, so it looks like a really taking a long time, but it really only take you 5 to 10 minutes when you do all the points like this. Do you feel warmer, right?
Not yet.
Oh!
Not.
Like this. So since it's not too hot, then you can press harder. But when it is really hot, you do like this. But well, you know, if it's extremely hot, you can't even touch it, right? So it won't never be too hot. Your hand, whatever you're doing, will be testing. Yeah, you go one more, two more down. So one thing, she has a thick hair, right? So she may not feel that much, but with the when we don't have much hair, then we need to watch the temperature more carefully. Okay. Oops. This one never happens except here today. I tell you why later. Like this. You feel right? Then another point you can do is you put it right here. Then you put it on the side. So each point you can put 3 times. You come back, put it back, then you can put it on. So like this. So for the surface, you can just, the oil, you can just clean the surface a little bit, but you can leave it in. Especially when you can leave in, and people ask me about the shower. And it's our questions from that. So I will answer you all of them one time, okay? So like this. So the reason why this one never happens before is I don't have the proper container for this for now. I forgot to put that one in. So I put the candle container. So what we need is you see, you put the oil in like this. Then you put this one in. You can put either one first. So when you refill, when you use the same bag like now, then you just refill the oil next time, okay? So I can do one more time on your hand because you probably didn't feel that much on the head. We just do one hand, okay? Yeah. Nice, right? Yeah, warm. Like that. Then you can just wrap it. But for you, I would recommend, especially people with a dry skin, I would recommend you use the oil to just massage through it. You can use the sesame oil instead of lotion, fancy lotion. Just use the sesame oil. And also on the head, when you get this really scratchy dry hair and scalp, they use the sesame oil or coconut oil. But right now, we just try to reuse what we have. Okay, thank you. You're welcome. Hi. Where would you like to try? Shall we start the hand? Sure. Yeah. And we can try one hand. It's not super hot. It's warm. But since you never had it, it will be a little hot. It's okay? Yeah. So when you just starting, just watch for the temperature. But once you get used to it, you will be fine. So since it's not too hot, you can press it. You can press hard like this. You feel different, right? When I just did the light weight, light pressure. Then you put it back. You squeeze the oil back again.
And this is half caraway and half nutmeg.
1 teaspoon each. Yes, 1 teaspoon each. So like this. Then, do you want me to try on your neck?
Yes.
Yeah. How about you turn the chair? Yeah. So you find the C7 right here. Then you can put it right on the C7 like this. It's warmer than on the hand, right?
Pardon me?
Is it warmer than the hand, the oil?
Maybe a little, yeah.
Little
but
bit,
it's
okay.
good. It's not too hot. It's good.
You press the oil in.
Feels better when you press more, right?
Yes. Then you do 3 times. So we'll be feeling like that, okay? So I don't know how you, but when you have those stiff neck, sometimes you wake up, you cannot move your neck, right? You can do this method. Not original, for that purpose, normally we have a different treatment, but this one, if it happens, you can still use it, because one time I went to a health fair, a lady walked in, she couldn't barely move her neck, and it just happened that morning. So I did a 8 minutes treatment, and she was I'm not 360, but like 180 for sure. She's moving without problem. So 4 hours later, she was still moving without problem. So this one really works well, okay? Then we don't have to worry too much, what's gonna happen. When you do the driving, you're so worried, right? Because it's really painful. You really have to see on the back. So this is what I did is I did here, then I did here. So for that purpose, you can also put a point here, right between. So
Good for a tight neck.
tight neck. Yes, for the tight neck, you can also start from here down, okay? So you can do here, do there, then here. Then you have the oil, right? Now you can massage into it. So for instance, you're doing yourself, you can at least massage the oil down, right? Just like that. Push it, yes, perfect, like that. Yes, thank you. So we have one station there, and I will pass you more of the paper towel for clean your hands. But you can try some of there, some of them here. I will keep adding more oil, okay? Would you like to try here? Yes. Paper towel. Okay, you tried? Okay, good.
Is that your business card?
Yes. And if people need to leave early, I just want to make a quick announcement. So this is the conference about next year that we're talking about. It will be in October, so there's all information. And this is my business card, and in the website we have a conference document from this year and last year. Okay, so
I'd just like to thank Nempa Kelsang and to share that the Kunde Institute is local here in Daly City if you seek to learn more from our wonderful teacher today. Thank you very much.
thank you. Yes.